Thank you very much to our report out facilitators. It is my pleasure to introduce our colleague Jessica Perlo, who is a director at the Institute for Healthcare Improvement. She will facilitate a session on key themes that we heard today and making commitments to advance the consensus study report recommendations. Thank you.
Hi. As Charlie said, my name's Jessica Perlo. My actual title is Director of Joy in Work at IHI, which this is one of the only places I can say that and people aren't cringing. So I just want to take advantage of that right now. It's such a privilege to be able to have us reflect on some key takeaways, to have us really have a chance to make commitments to one another and to ourselves as a result of our work together. To do that, I'm going to share with you a commitment my organization has made. So the Institute for Healthcare Improvement, if you're not familiar, we're in Boston and working across the globe. Our mission is to improve health and healthcare. And one of the ways we do that is by focusing on the joy of the healthcare workforce. We use our values, which we've talked a lot about today, to guide us. And really what we're trying to do is to give people quality improvement methodologies to address some of the factors that are contributing to burnout and produce joy. And people often wonder why we chose joy in work as the topic. And I think it really harkens back to Edwards Deming, who said that management's overall aim is to produce systems in which people experience joy in work. To Deming, joy is a product of high reliability organizations. It's a function of quality improvement. And he talked about this decades ago. And so we've used this as a guidepost for us. We also know joy is more than the absence of burnout. We've talked a lot about this today, but just as Aaron Antonovsky encouraged us to think about health as more than the absence of disease, so too joy is more than the absence of burnout. And so I love the opportunity to think about what's working and to harness that from within the organization as well. And so that's what we've been doing. So this is the part where I'm going to summarize 5 years of work in 3 slides. And when we started this work in 2015, we did the typical thing IHI does, which is we did innovation waves, we did research, we did interviews with folks inside and outside of healthcare. We talked to Starbucks and Melno Innovations, and we then applied those lessons through prototype testing with some institutions inside of healthcare. And what we discovered then, and what's not new to you but really is still very much persistent myths, is that people are still thinking about this with a really old way of thinking about joy. So they'll say, we have pizza parties already, we have a really great staff recognition program, that it's individuals' responsibility, they need to buck up. This is a millennial problem. We have an HR and an OD team. Our occupational development team actually handles that, so don't worry about it. That this is all about turnover. We've talked a lot about that today. And that staff just want money and benefits. And this kind of sounds silly right now because we've been talking about this all day, but this is the reality of the conversations that are happening around the globe around this topic when we first start to work on it. So we have some work to do to talk about some new mental models, which we're willing to do. And our partners, we were actually really surprised in 2015. We worked on and then eventually published the framework I'm going to share with you. We had thousands of individuals from around the globe. We were expecting health systems. We weren't expecting so many burnout individuals looking for help and improvement giving them the excuse to do it. And what they were asking us for, both at the system level and the individual level, was a not overly complicated step to get there. And while the steps here are very simple, that doesn't mean they're very easy, because what we're talking about here is culture change. This is really the how of the work. That first step that we talk about is ask what matters. How often do we actually slow down and ask people that we work next to every day for years what actually matters to them and what makes for a good day? Similarly, how often do we reflect on what our values are and share them with one another? Almost never. And so our partners this is again and again the most important part of the work. They're finding this to be an opportunity to actually start to look at, okay, what makes for a good day? And then have the conversation in that second step around, okay, well, what is getting in the way of more good days for you? What are the pebbles in your shoes? It opens up a space to have a new conversation with an old colleague. And in that second step is where we start to address some of the innate human needs that aren't being met: meaning and choice and camaraderie and equity. Oftentimes, these are pebbles in their shoes, and all we've talked about today have been the boulders. But I promise you, there are things we can do together by next Tuesday to start to act and change the system. And one of the ways we do that is by encouraging people in step 3 to think differently about who they're engaging in this work. This is where our inequities come in big time. So yes, we have to have nominal positions of authority and responsibility for the work, but we also have to distribute responsibility. And we have resources and practices to do this. I like to think about, can we empower people who aren't traditionally in the conversation to lead change and local teams to lead improvements? Can we have the people with the problem be the authors of its solution? And then we use improvement science. We start small. We don't have to reinvent the whole system. Let's start to test. Let's learn. Let's fail. Let's talk about what didn't go well in this setting and try it over here. This is an addition. This is the implementation science part of what we're all talking about today, and it's working. Our partners are doing this, and we're really excited to be able to do more of it. The second part of the framework, which I'm not going to get into too much because we've talked about it a lot today, it was reflected in the study, is really about the what of the work. I do want to point out that first step. So people were asking us, what's most likely under my locus of control, and we wanted to show the underpinning of senior leaders' responsibility for joy in work, but that there are places for everyone to exercise agency and lead change. But that importance of physical and psychological safety, it came up earlier, but it has been critical with our partners. If we don't address harm and injury to our workforce, the safety of our workforce, we cannot make inroads in other areas. That's that Maslow's hierarchy. We have to make sure we're safe in our workplace. And I think that's a good place to start. So one of the commitments IHI is making to this work is to launch a collaborative. We're already doing this work, but we're starting in January an 18-month results-oriented learning network. This has been funded by Coveris, Med Malinsurer, by our board, and by our partners directly. We are doing a traditional collaborative. If you're familiar with IHI's collaborative work, we bring people together. We know we're better together. We test changes. We come together throughout the course of 18 months, and we learn and we iterate, and we fail, and we celebrate. Hennepin Healthcare is our co-leads on this work, so Mark Linzer and Elizabeth Gels are helping us lead it. And then these are some of the institutions who have signed on so far. It's not too late for you to be involved if you're interested, but regardless, our commitment to all of you is to disseminate what we learn and to contribute to the body of knowledge around changes that we should be adopting and adapting in the pursuit of well-being and joy. So that's our commitment at IHI. I now want to invite you all to do the same. So I'm going to ask you to just silently for a moment. We've had a lot of extrovert time. Let's have some introvert time to just kind of think and reflect on what are some key takeaways today for you. And then in a moment, I'll ask you to share them with someone next to you. Thank you for taking this time to chat with each other. Clearly some rich conversations going on. I also wanted to offer an opportunity. There's lots of different ways that we're meeting this work and lots of different ways we're acting on it. A lot of folks are already making commitments to this work, either as a result of the study or they've been doing this work, and you're all in this room. And so I want to honor that by giving us an opportunity to share those commitments. There are 3 different ways you can do that. There were little cards that you picked up with the artwork on the back. You can write down your commitment if you want to make it to yourself and bring it home with you. You can come up to the mics and share, and my commitment to you is to capture what you've shared and share it on the website with our notes. Or you can poll everywhere, which I need Charlie to figure out how to do this in a moment. Hopefully, you should be able to chat in your commitments virtually as well, especially for our friends if they're joining virtually. All right? Any questions about that? Commitments you're making to the work.
So, one, thanks for a great conversation today. Jay Bott, American Hospital Association. One thing we're going to do right off the bat is tomorrow to all our members, share some takeaways from this conversation, as well as the consensus recommendations, and ask people to engage with the tools and resources that we've pulled forward through this collaborative. And the ones we have, then we'll continue the work. And then 2 is following up on this conversation with CEOs and governance, and engaging them in these recommendations.
Thank you.
So at ACCME, we've already shared the report with our 1,700 accredited healthcare organizations. And we've also added a wellness track to our annual meeting, which includes sessions about integrating continuing medical education, learning, culture, and these issues.
I bet those are well-attended sessions. Any other commitments? Do you want to share them?
I just said, can we use the poll everywhere?
I know. I don't know how to do that. I think, is it up right now? It's up, but not projecting. So you can actually see the poll? I can't see the poll, so I don't know what the question even states to have you prompt it. Is Charlie nearby? It's all right. Yeah, go ahead.
While we're waiting for Jessica, I just want to thank you, and I know we're eager to get on to the next and ultimate part of the day. But I just want to say that some people, and I've sensed this talking to people, are reluctant to make an institutional commitment because they don't represent a large organization or even at a high management level, leadership level in their own organization. And one of the things I just wanted to suggest that I certainly am doing is, having been involved in this report, and those of you who are involved in the collaborative, just using that for leverage in whatever way you can in your setting, in your institution, within your group. First thing that happens is that everybody cares about this issue, and it brings this energy together. And so you're kind of giving permission for recognizing that. And secondly, it begins to, I think, nationally normalize that everybody is paying attention to this, and this is really important. And so it really creates that leadership momentum.
Yeah. Thank you for that. I think we're eager to move along, and it's been a long discussion today. I want to thank you for letting me close us out with some reflections, and thank you.